My first trimester was one of the more challenging parts of my pregnancy. It's something that you experience physically, but it takes a toll on you mentally. Navigating through this pregnancy, I feel like wouldn't have been as easy if it wasn't for having a doula. She helped me understand that pregnancy is not a sickness. It was eye-opening for me because it made me shift my perspective.
A doula provides non-medical, emotional, and physical support. They're providing evidence-based information, as well as information from their own experience, providing support to many birthing people. Accompany Doula Care is an organization that aims to provide birthing people the support that they need to be successful in their pregnancy, during their birth, and in the postpartum period as they navigate that journey of parenthood.
The doula helps a patient with how to approach having a baby and has the benefit of spending more time on those particular topics than I ever could.
Having a doula that can come to your home, being able to teach you how to use your own home to labor, there's definitely a sense of ease there. My birth was the biggest light bulb moment. It also takes a toll on you, especially if it's your first, maybe even your second, and to be able to have somebody that can support you in that way is so crucial.
The reality of medicine is when we don't provide resources for patients in their medical care, we will end up paying for it down the line when people have more complications or inconsistent care.
It's so brand new to me. We're getting to know things like burping him, tummy time, and why that's important. Is he cluster feeding? How is he sleeping? And things about me. Healing correctly, my mental state, my physical state, any things that we experience after birth that are essential to understand.
There's such a tremendous benefit of a doula in a patient's care, particularly for patients who have inadequate resources like housing or food, also language barriers and system barriers.
Our goal at Accompany is that if a person wants additional support during their pregnancy, during their birth, during their postpartum period, and they want that person to speak their language, share some level of a lived experience, they can come to Accompany and get connected to that person.
Patients are having a better experience and they feel more supported. And entities like Doula Care are incredibly important for public health.
Doulas need to be nationally recognized as an essential member of the pregnancy team. Doulas are helping to provide equitable care, but doulas themselves are not getting equitable support. They're also not being paid equitably so that they can sustain this work, particularly doulas of color. The role of Accompany is to connect mothers to doulas and doing advocacy work on the local and national level so that anyone who wants the support of a doula can access it, but also this can be a sustainable workforce.
If I didn't have that support, I don't know if I would have made it through the way that I did. Having a doula is essential.